just want to share with you a little background about the deaf community here in Malaysia. As being health literacy among the deaf people, as mentioned, is very, very limited. And also, deaf people face challenges in written bahasa or English papers, nor are they proficient in the spoken language. So again, everything is very limited. So they interact with the doctors or medical personnel, and can they understand fully? I don't think it does. There many misunderstanding does occur. Sometimes deaf people would set up an appointment to see their doctor. They get the numbers and they keep on waiting and waiting, because some of the medical people will just call out the name again and again, and they will be sitting down there. It's really, really a waste of time. There's no communication to them that their numbers or names have been called up. Yeah, so again, it also depends on the environment of the place they go to, how friendly they are. And from the community feedback, and this is what I got, a lot of them say, I don't know the doctor's name. He never tell me his name. And I asked some of my friends, what happened to your wife? How did she die? And the reply said, I don't know. She just gave birth and she passed away. So all the information practically drowned. So they get very limited information. And some of the medical personnel just provide them with the medication. Some do say you eat it in the morning or 2 times a day, but never mention that it is for what purposes and what would it help them. And a lot of deaf people comment that they're sick and what happened and how did you get that sickness? And some had got heart attack or heart problem, but prior to that, the wives or the people closest to them also don't know how he got it, how this person has got, and they don't know where to get information either from the internet or so. It's a lot of guesswork happening. And some of the challenges that we face, deaf people, in generally, I'm not saying each one of them, but in general, they have very limited knowledge on the medicine and what the doctors write to them. And the most difficulty is to explain to them what is it. So they have to repeat and repeat, repeat and repeat again. And most of the deaf people depend on the family members, of who they have, especially in medical counseling or when they go and visit the doctor in the hospital. The medical person may explain something and the family members may understand, and it's huge knowledge. But what is being transferred or translated to the deaf person is, oh, you're just sick. This is the medicine and that's it. That's the limited. And says that you're healthy and no problem. But the doctor did express that, perhaps that he's got a severe sickness or whatever. But the deaf may misunderstood to say, hey, I'm okay. And, so that is another example of a communication barrier. The third challenges that we have faced so far is BIM interpreters. Are there many of them who are skillful? Actually none. Not many, sorry, not none. There are only very few interpreters that we contact directly. We know of them. But some deaf people don't know the availability of sign language interpreters that whether they could hire the interpreters and make payment, because they felt that, oh, it's free. So this is another problem among the deaf community. Yeah, so many deaf people expect or think that deaf people, the services of interpreters are free, because all their life they've been like getting free things from donors, from sponsors, from buses, transportation and so forth. So when they thought about interpreters, they also think it's free. So this is also a good time to educate our deaf people that the services of the interpreters are to be paid. But again, the environment of the community, we have insufficient interpreters to serve the needs of the deaf people.